afternoon, everyone. Gareth Presch, founder, CEO of the World Health Innovation Summit. I am delighted to welcome Dr. Laura Holland, co-founder of Vegemi, to our episode 10 of the Innovators Show. Laura, it's a pleasure to welcome you to the Innovators Show. Delighted to have you on board. Please tell our audience just a short introduction.
Absolutely. Well, thank you, Gareth. It's a real pleasure to be here with you and to have the opportunity to share Vegemi. So as you have just said, my name is Dr. Laura Holland. I'm a nutritionist, so I'm one of those people that get really excited and passionate about food and what people are eating. And Vegemi in particular is really focused on children's nutrition and making sure that we're doing all that we can to make healthy eating for kids as fun and as engaging as possible, to really safeguard their future health and well-being outcomes, which I just think is just so important, especially today when we look at the state of children's health and actually our health at large, basically around the world. So yeah, it's great to be able to talk to you about this today.
Well, it's such an important topic, and also, you know, children's health, well-being. This put pressure on the future of health services. I really like the work that you've been doing with Vegemi, with your co-founders. We've had experience. We met each other in Finland. You're doing a lot of pioneering work. I love the link between nutrition, health, but also you're linking in dentistry as well. And I'm really excited to sort of like share this journey of yours and share this story over the next like 35, 40 minutes. So tell us a little bit about your personal journey, you know, your inspiration, you know, what inspired you to pursue a career in innovation, particularly in the health sector? Like what is it that got you into this?
Yeah, well, my first degree actually was in economics, and I worked in London as an economic analyst for the first couple of years after graduating, and I loved my degree, but I very quickly realized it perhaps wasn't a career path where I felt genuinely passionate and fulfilled. And so nutrition was something that I'd always had an interest in, and primarily because I noticed that health was a real source of stress and worry for a lot of people, regardless of your background or your circumstances. I just noticed that people's health was a real source of anxiety and fear. And I also noticed that especially I'm 42, so back when I was growing up, there was certainly this sense of, you know, your health is kind of like in your doctor's hands, so to speak. And so there's this sense of maybe this lack of empowerment. And I think that also added to a lot of fear and stress. And that was always something that struck me as not very positive, and something that really didn't sit very well with me. And I really felt that there is a lot we can do and should be doing to take charge of our own health and well-being, and in that way kind of start to alleviate some of that fear and anxiety that is with so many people. And you know, and I think health is one of those topics as well where, yes, you worry about your own health and well-being, but you also then have a lot of worry for your family and your loved ones, parents, grandparents, children. So it just seems to be this topic that can cause so much disruption in our lives. And I just saw that there's so many things that we can actually do to reduce that fear and that worry and really start to empower people. And I guess in many ways also empower myself. I really wanted to understand what I could do to support my own health and well-being. And so that's really what guided me down this track. And I retrained and became a nutritionist and a clinical nutritionist. I continued my studies in integrative medicine, and then I've spent 15 years consulting with clients, both corporate and private clients, in the field of nutrition and well-being. And it's so rewarding to see like how, you know, this type of information and these type of tools and practices in daily life can just give people so much relief and a sense of positivity about them being the creators of their own health and well-being destiny, so to speak. And so that's really then what I guess continues to fuel my work in this area, and why then I'm so passionate about Vegemi and how we apply that to children. So yeah,
That's
hopefully that
kind of
explains.
yeah, that brings me on to the next question. Like, so, you know, you've all this experience, you've done 15 years, you know, you've been, so what sort of like defining moment on your journey led you onto the path of Vegemi, you know, that sort of solidified your commitment towards children's health and well-being, I guess, and you sort of outlined some of the touch points with fear and anxiety, and that certainly plays a part with children's health, because I'm sure a lot of families are looking at this, and even me as a parent, I worry about what my children are consuming.
Yeah, absolutely. I think for children, what really is a driving force for me with Vegemi specifically is children. We're in an environment, a food environment, where children are making food choices and perhaps are completely unaware of the consequences of the food choices that they're making. And so whilst adults, we kind of do know, we might not have the detailed knowledge of nutrition, but we kind of know what's healthy, what's supportive of our health and well-being, and what's not. But in the case of children, they may not have fully formed those ideas and that understanding yet. And at the same time, they're in a food system which is, heavily influencing them to be making food choices that are actually going to do detriment to their health and well-being as children now, but also certainly as they grow up into, being a teenager and an adult. And I just think it's, I almost think it's like a moral obligation that we have to do something to ensure that children are empowered with the knowledge and the skills to be able to make food choices that are actually going to nourish them rather than harm. And so I see children as being quite a vulnerable group in that sense. And so really, more needs to be done to be protecting and safeguarding them.
Totally, like I totally agree. You can see it everywhere, and like every part of our life, children are actually targeted by marketeers, and normally the foods are not really what they need. It's not full of the nutrients that they need. It's very difficult, and it's difficult for the parents as well, because they're under so much pressure to help and support that child, or they don't want to see the child disappointed. So it's a very complex area. So Vegemi is a welcome addition in terms of like this narrative, giving people the tools to manage their own health and well-being. Tell us a little bit about Vegemi, about the innovation, about what you're doing, what specific problem does this sort of solve? We know we're tackling health, nutrition, children's well-being. How did you identify the need? Is there any statistics that you'd like to share with people who are listening in here? Give us some specifics.
Yeah, absolutely. Well, we know in the UK that our children's health is suffering. I think we have like 22% of children that are 5 to 6 years of age are overweight or obese. We also know that by the age that they're 10 or 11, that number has actually increased to 38% of children being overweight or obese. We also know that by age 5, 60 to 70% of children's diets are actually coming from ultra-processed foods. And whilst ultra-processed foods are, they're not nutritious in any way, but they're also biologically disruptive. So it's almost like a double whammy. So kids are just basically filling their diets with foods that aren't giving their body what they need in terms of nutrition. And it's important to recognize that those nutrients allow the body to function optimally. So not only are they not getting those, in fact, I think less than 1 in 5 children in the UK eat the required amount of fruits and vegetables a day. But they're also eating these types of foods that are disruptive to their bodies, to the way that their body functions, causing all sorts of health issues, which, and that's not just confined to physical health. It also has a major impact on their mental health, their ability to focus and to learn, their ability to emotionally regulate themselves. And, it's no surprise, we've also seen a massive explosion in children's mental health and ADHD and these sorts of challenges as well, of which I know they're complex issues with multiple variables, but nutrition and diet is a significant factor there. And we really do need to be doing more. And that's where Vegemi is really, focused at solving that problem, solving that pain point.
And that's the next sort of question. How does your innovation improve the current approach to our system, in terms of, but it's staggering the numbers that you're coming up with, because if you look at, say, in a 10-year trajectory, where those individuals would be, like you said, 11, and if it's almost 40% obesity level. And if you look at the current health system and where we are now, which we are completely flatlined, it's struggling as it is, all you can see is that curve going up in terms of, like, health outcomes. I mean, this is why we need those solutions like Vegemi front and center, and we need to be able to get that out there and share that information. So how will your, this innovation, Vegemi, improve? I mean, you have some results on the ground because you're doing it in Finland and other areas.
Yeah, exactly. And I think it's important to say with Vegemi, like, I'm a nutritionist, so obviously I'm passionate. I can get very excited about nutrition, but often nutrition can be quite a dry subject. And, as soon as you mention the word healthy and food, you can get a few eye rolls, and I totally understand that. And so with Vegemi, it's really, we're really focused on making this fun and exciting and playful, and really empowering children to lead the way in that. And so Vegemi is really focused on engaging children in multiple settings where they're spending a lot of their life. So we have a complete nutrition and health education program that can be implemented through schools. It's designed to be delivered by local teachers, so it's fully scalable, it's easy to implement, and it also gives the teachers something cool and an easy way to engage the kids. It uses characterization and gamification, both key things that we know incentivize and really encourage that engagement from children, especially relative to their food and their eating behaviors. So we basically are using the tools that ultra-processed food companies use very successfully to get the kids eating foods that are not that healthy, to be eating fruits, veggies, and all the nutritious stuff, and making that as exciting and as fun for them. And I think that's a critical point, because obviously education is important, but it's really about making it fun and exciting, and gamifying that relative to children. And so, yeah, we have an education method that goes through schools. We also have resources to engage children and the families that also are going through public health. We also work with retail and healthy food brands to really make sure that we're highlighting and incentivizing families to go for the healthier options in the supermarkets, and rewarding them for doing so. And yes, we're active in Finland. That's obviously our home country, but also now we're working extensively in the GCC, particularly the UAE and Saudi Arabia. We're also working in the Caribbean, and also in the UK as well. I would love to be doing more in the UK, but we're just on our early part of our journey here, but it's exciting.
Well, and that kind of leads on nicely, the impact outcomes. You talked about Finland, GCC countries, and sort of UK. What impact do you sort of envisage? You were giving some examples there, sort of like what the innovation will have on communities, global health, and then, like, so how do you see that playing out, given the need as well?
Yeah, we at Vegemi, we have quite an express target to try and just, because this is a huge area, and it sometimes can be difficult to quantify the impact, to make it, relevant and, easy for people to understand. But with Vegemi, we've obviously got a multitude of aims, but our main driving force is to influence behavioral change in children's eating. And we are committed to, for every child that we're interacting with, if we can get them to swap just one of their ultra-processed food snacks for an additional portion of a fruit or a vegetable every day, we can actually reduce their type 2 diabetes risk by 25%, which is enormous. And that obviously then has knock-on effects in terms of obesity and all other health indicators. And so Vegemi is really about recognizing that we're not pushing for this perfect diet, which actually doesn't exist anyway. You know, that textbook perfect diet, it doesn't exist. It's, you know, what we need to eat is for health and well-being is very individual. It's different for each of us. Vegemi is really about helping children to go on that journey and find what feels good for them. So in that way, it's gently nudging eating behaviors in the direction of supporting their health and their well-being. And so that is our express target, and that's how we're able to measure our impact. And so far, the impact has been really incredible.
And that was sort of the next question, like, you know, how do you measure success? Effect, I guess, you know, you're probably getting cases now across Finland where you're getting feedback from the parents, you're seeing a bit of results. You know, and also from your perspective, like, how do you see success and how do you measure effectiveness in terms of Vegemi? What do you see as success?
Yeah. Well, one thing that it strikes me every time I'm in the same space as kids that are interacting with Vegemi is the relationship the kids build with the character. We teach the children that Vegemi is a good stomach bacteria. He's part of their microbiome. He lives inside of them. So when you feed him fruits and vegetables, he gets superpowers, and the child gets superpowers as well. And that whole story just seems to really grasp their imagination, and they get very excited about it. And that character piece and that story piece really seems to resonate in a way where they kind of take ownership of that, and you can genuinely see them excited to eat fruits and vegetables because in their minds they're feeding their Vegemi and they're going to get superpowers, which I just think it's just like so simple and so genius, because we don't want to like lecture them to death with, you know, fear-inducing education that they've got to eat this, otherwise they're going to get X, Y, and Z disease, you know. But just by making this fun, we're helping them to lead their way in making their own choices that are really supportive of them, and just to see that fun factor. And go on.
It works. Keeping it simple works. Like I see it with my two daughters, for example. You know, like if, you know, they're doing park run at the weekend, or they're doing, you know, gymnastics, and they're playing football, and I explain to them, you know, you need to eat fruit and veg if you want to become stronger, and they do it. That's what they want it on, and then they say, well, I want it because it makes me a better footballer, or it makes me a better gymnast, or so. And it's that encouragement as well. It's that encouragement to sort of, you know, like, you know, I brought Darcy home from football last night and she wanted to have an apple. Absolutely, have an apple. You know what I mean? But it is a change in narrative. And that's the mindset. Speaking of challenges, learning experiences. So, you know, what lessons have you learned, you know, from your journey working with Vegemi that you would like to share with aspiring innovators? You know, because as an individual, we're constantly, especially as an entrepreneur, we're constantly learning. We're constantly on this journey of, you know, ups and downs, and this is quite an interesting part of our life, you know, because we decide to go down a path which sometimes is fear-based. So it's interesting.
Yeah, I mean, from a personal perspective, I highly recommend meditation and breath work just to be able to navigate the highs and lows of being in this line of work naturally brings. But I think innovation, I think the key is in the word, right? It's an innovation, so it's never been done before, which means it's going to go through a process of iteration. You know, you have I think when you see the problem so clearly, and then you understand the need and the solution, sometimes in practice, that need and solution definitely needs a process of iteration to find its fit, to find where it's going to really sit and be able to be implemented in an effective way. And I think that that process is inevitable. And I think if you can go through it with an open mind and really work with key partners and find those people that are your early adopters that you can then work with to refine the idea, so then it can be scaled out really easily. I think that's my best advice, and we've been fortunate to find those early adopters where we've gone through that teething, painful process. And it's always I think iteration and the innovation is always evolving. That's a constant process, but it's nice to get beyond that first part, which is always the hardest for everyone.
Yeah, totally agree. And so what are sort of like some of the biggest challenges you faced while developing Vegemi? How did you overcome them? Is there anything specific that stands out for you? Because you're developing a new product, you're trying to implement, like particularly in risk averse areas. A lot of these sectors are very risk averse, so it's difficult to get that traction. Challenges that you could share.
Yeah, Vegemi, in terms of in the education sector, nutrition, ironically, is not given very much importance in standard curriculum. And as we know, the curriculums are so packed, teachers are so stressed and overwhelmed. Adding something else into the curriculum, into that school day, has been a huge challenge, even though nutrition is something I think foundational to a child's ability to learn. Even, we know that when a child eats better, they perform better academically. So it's as far as I'm concerned, a key priority. But we've had to really allow Vegemi to, whilst also teaching nutrition education, to also support math and literacy skills as a means to find space in the curriculum to be implemented. On the public health side, the budget for nutrition interventions. Now, I happen to think nutrition is one of the most effective preventative medicine tools, preventing disease we have. But yet, when we start to understand what the budget is allocated for, it's not great. I mean, I know. I mean, that's putting it mildly.
Yeah, well, I mean, if we take in context, 98% of budgets goes on disease, probably have 2% on health promotion. It's peanuts.
Exactly.
So it's not a lot of money at all. So
yeah.
Big challenges. So sustainability, future plans. This is very topical at the moment. We are in a geopolitical flux at the moment. How does Vegemi align with the SDGs, Sustainable Development Goals, good health and well-being? I mean, it's very much front and center around nutrition. Yeah. And then sort of what are your future plans for scaling as well?
Yeah, well, we've with everything, with each of our verticals or operations of which, whether it be in education, public health, or retail and brands, we've developed Vegemi in a way that is scalable and also open to localization. Obviously, each country is different and requires slightly different approaches, and we've managed to build Vegemi in a way where it can accommodate that really comfortably. And so that scaling is quite an easy process for us. And it's an important one because, we're only going to make an impact if we reach as many children as we can. And our goal is to reach children globally and to ensure that each child has the opportunity to play with Vegemi and so get excited about making food choices that are nourishing to them rather than harmful. And whether that's through education or perhaps through retail and partnering with brands. We also have the Vegemi app, which is an amazing tool. It's a free app. Every family can download it. And then the child can play with Vegemi, so they get to learn as they're playing these games. Obviously all about nutrition. But then there are also resources on there to support parents in understanding their child's nutritional needs. And we also have aspects of dental health and mental well-being, the environment. And so, with the Vegemi app, that also makes us sustainable because we can reach and scale families. And so that's, because our mission is a global mission, we have spent a lot of time making sure that the solutions that we're creating with Vegemi are also appropriate globally.
And that sort of brings me very nicely on to the next question around collaboration, partnerships. I mean, this is what will make that Vegemi stick, so that's the importance of having a global network. How important is it to have the right partnerships? How important have they been in your innovation in Vegemi's development? Are there any key collaborators you'd like to mention? I think this is part and parcel of this venture, that you're on this journey with Vegemi to get it around the world. You need that collaboration and partnerships.
Yes, the partnerships are incredibly valuable to us, and they've been a huge part of our success and our development. So whether, right from the beginning in Finland, city of Espoo, we collaborated with them to co-develop the education method. In Finland, our retail partner, SSO, have been amazing in helping us to develop that retail element of Vegemi's activities and making that fun for families and kids when they're shopping and, buying healthy foods. And then in the Middle East and the Caribbean, those government partners, the Ministry of Education, Public Health, in Dubai, specifically the Dubai Health Authority, they've been incredible partners that have really supported Vegemi's activity and our ability to innovate and to be active in the market. And, that's something that we seek to continue. And, that's a key part of our strategy, because we can't do this alone. We have to come together with partners that have that same mission, that same heartfelt way of approaching problems like this. And so they're a huge part of our process.
And that's sort of like it brings me into the next question, the cross-sector collaboration, which you've sort of been describing here, and the meaningful. So, you got to have meaningful partner, people who have an outlook that is impactful, like you're saying about getting the word out there to address these challenges, because the nutritional challenges are there. We've talked about it earlier on, obesity levels, particularly in some of the regions you've mentioned as well. They have huge problems. Diabetes levels are skyrocketing. So this early intervention is a great way to prevent that escalating.
Yes, and I think I think it's important that we create an ecosystem which can also start to inform policy moving forward. And that's why that cross-sectional, partnering with government as well as the private sector and education, that creating those touch points is really valuable in creating an ecosystem which actually does then create an environment to start to make some changes. And education's great, but unless it leads to behavioral change, we're not actually achieving very much. So for us, those key partners that can also drive policy change, we can also start looking at what consumer behavior. We can connect the home environment and start to engage families in their home. All of these pieces together start to form a very powerful picture that is capable of systemic change, and as well as change for the individual and the family.
I love the way you talked about behavioral change. That's what's really complex, particularly in health. It's changing behaviors. So we've had it for years. Policy comes in, but it doesn't change any behavior. So that's so important. I love the way you're bringing in gamification, and you're beginning to, that narrative of fun. That's exactly what the health system needs to do. It needs to embrace that on a wider context. So this is really great stuff. Advice for aspiring innovators, people looking at this today saying, I'd love to get into this. I want to try and do this. And, sort of what advice would you give someone who's starting out in the field of health innovation? That's a difficult area to start as well. It's probably one of the most complex.
Yeah, it is complex, and it's certainly not for the faint of heart. But I think my best advice would be to really stay true to your mission. And if it's a heart-led mission and you are focused on it, I think it's inevitable. Yes, it's going to take some time. Yes, it's going to take multiple conversations. Yes, you're probably going to talk to people that, this is a great idea, but, it doesn't land with them because it's not part of their strategic priorities. don't be dismayed by that, because there are those where this is going to be their strategic priority. So I think, you know, if as long as you have that strong commitment and it's a heartfelt commitment and you're focused, just keep having those conversations. And I do believe that over time, if you stay true to that, you will, call it the universe, synchronicity, conscious, you will start to attract and come into contact with people that, you know, are on the same path of you and have that same energy, and it'll start. You just need to stay true to it and keep going. And I think, you know, you will then find yourself meeting the people that actually something really great can happen.
Completely agree. And it's that fear, like you gotta lose the shackles and just go for it and just stay focused. I think the focus, the mission driven, always keep the mind on the goal, and sort of like, yes, there's difficult times, but sort of from your perspective, how can you stay resilient? You know, so motivated, the ups and downs, these are techniques that you have to embed daily. Particularly if you're in health innovation, you know, it takes on average about 17 years to implement something in the health sector. So that's a long time. You've got to be resilient, you know. And we've aged quite well, I think, given the circumstances.
Yeah. Well, I think have fun. This has got to be fun. You've got to make it fun. So, you know, I mean, I mean, I don't know about you, Gareth. I mean, I'm sure your work takes up a huge chunk of your life, and, you know, Vegemi and it takes up a huge chunk of mine. So you've got to make it fun. But on the other hand, like, especially if we're in health, we have to look after our own health and well-being. And so you literally then are a good representation of everything you're talking about. And so for me, again, I've mentioned it before, but meditation, breath work, and, you know, those tools I find incredibly helpful for just keeping my mental and emotional health and well-being balanced, my ability to focus, and also not to take stuff too personally as well when things are a little bit rocky or it's not going quite your way. Those tools just help me to be more discerning, which then just help me to stay more focused and be able to keep going and to, you know, stay positive and focused. So fun and look after yourself.
Go and look after yourself. Yeah, I couldn't agree more. I really like all those points. You've just got to, you know, and I think as well, you've got to look after your own health and well-being. It's something as an innovator, as an entrepreneur, you do neglect. I think you neglect that at the early stages, because you'll do those late nights where you won't get your rest. And even with, you know, your consumption of being on the road, you've probably experienced this. I have, you know, we're running through airports, you're running through, you know, you're on a bus or you're on a train or wherever you're, you know, you're flying. You don't have the time to sort of like, well, you should make the time to sort of have that, you know, the banana or the apple at a certain time. And that's all comes with experience, you know, you start to navigate that. Laura, it's been a pleasure to share, you know, this show with you and learn more about Vegemi. Where can people contact yourself? More information about Vegemi, website, and so on. We'll put all those links in the description. But it's been a pleasure. What's the final message?
Well, I think my final message would be that we need to make nutrition and healthy food fun and exciting. And I would love for you to, if you're a parent especially, to go to the App Store or Google Play and download the Vegemi app. It's totally free, and start, you know, playing with the kids and getting them introduced to Vegemi. And let's start bringing some fun into nutrition and healthy eating, and making some changes that are positive.
Well, I think that's a wonderful message. I'm delighted. I hope you've enjoyed this episode 10 of the Innovators Show with Dr. Laura Holland, co-founder of Vegemi, and from myself, Gareth Presch. We'll see you on the next episode. And I just want to say thanks for tuning in. We're grateful for the support. And myself and Laura will see you out there trying to make positive change, particularly around nutrition and health. So stay tuned for the next episode, and we'll talk very soon. Thanks, everyone.